Welcome to Roadmap to Residency, and this is a video on immunomodulators and anti-cancer drugs. So, which of the following immunomodulatory agents is the most appropriate next step in the management of patients moderate to severe plaque psoriasis? A 35-year-old woman with a history of moderate to severe plaque psoriasis presents to a dermatologist for evaluation of worsening skin lesions despite treatment with topical corticosteroids and phototherapy. She reports significant pruritus, scaling, and erythematous plaques involving approximately 30% of her body surface area. Physical examination reveals well-demarcated raised erythematous plaques with silvery scales on her elbows, knees, and scalp. The patient expresses frustration with the impact of her psoriasis on her quality of life and requests alternative treatment option. Which of the following immunomodulatory agents is the most appropriate next step in the management of these patients moderate to severe plaque psoriasis? Methotrexate, adalimumab, cyclosporine, ustekinumab, or acitretin? So the answer is ustekinumab. Ustekinumab is a monoclonal antibody that targets interleukin-12 and interleukin-23, which are the key cytokines involved in the pathogenesis of psoriasis. By blocking the interleukin-12 and interleukin-23 pathway, ustekinumab reduces the inflammation and inhibits the abnormal keratinocyte proliferation characteristic of psoriasis. It is proved for the treatment of moderate to severe plaque psoriasis in adults who are candidates for systemic therapy or phototherapy and has demonstrated efficacy in achieving skin clearance and improving quality of life in clinical trials. Now, other options that you might have been confused are here. You can just pause the video and go through these options. So, which of the following monoclonal antibodies is the most appropriate next step in the management of these patients' refractory rheumatoid arthritis? A 45-year-old woman with a history of moderate to severe rheumatoid arthritis presents to a rheumatologist for a routine follow-up visit. Despite treatment with methotrexate and a tumor necrosis factor inhibitor, TNF inhibitor, the patient continues to experience persistent joint pain, swelling, and morning stiffness, significantly affecting her daily activities and quality of life. Physical examination reveals synovitis involving multiple joints, including the wrist, MCP, and knees. Lab tests show elevated level of CRP and rheumatoid factor. The patient expresses interest in exploring alternative treatment options for refractory RA symptoms. Which of the following monoclonal antibodies can be used? Infliximab, rituximab, adalimumab, tocilizumab, or sertolizumab pegol? So the answer is tocilizumab. Tocilizumab is a monoclonal antibody that targets the interleukin-6 receptor, a key cytokine involved in the pathogenesis of rheumatoid arthritis. By blocking the interleukin-6 signaling pathway, tocilizumab inhibits the inflammation, reduces the synovial proliferation, and attenuates joint damage in patients with RA. Tocilizumab is approved for the treatment of moderate to severe RA in adults who have had an inadequate response to one or more TNF inhibitors or other DMARDs. The other options are explained here. You can pause the video and go through these all. Now, which of the following chemotherapy agent is the most appropriate next step in the management of this patient's metastatic colon cancer? A 55-year-old man with a history of stage 3 colon cancer undergoes surgical resection of the primary tumor, followed by adjuvant chemotherapy. 6 months after completing adjuvant chemotherapy with 5-fluorouracil and leucovorin, the patient presents to his oncologist with complaint of recurrent abdominal pain and unintentional weight loss. Imaging studies reveal multiple hepatic metastases consistent with disease recurrence. The patient expresses a desire to pursue further treatment to control his metastatic disease. Which of the following chemotherapy agents can be used? Oxaliplatin, irinotecan, cisplatin, cipacitabine, or methotrexate? So the answer is oxaliplatin, which is a platinum-based chemotherapy agent that forms DNA adducts and induces the intra-strand and inter-strand crosslinks, leading to DNA damage and apoptosis of cancer cell. Oxaliplatin is commonly used in combination with fluoropyrimidine-based chemotherapy agents such as FOLFOX, which is folinic acid, fluorouracil, and oxaliplatin. As a first-line treatment for metastatic colorectal cancer, it has demonstrated efficacy in prolonging the progression-free survival and overall survival in patients with metastatic colon cancer. Here are the wrong options. You can pause the video and go through these. A 60-year-old woman with a history of estrogen receptor positive and HER2 negative metastatic breast cancer presents to her oncologist for evaluation of disease progression. Despite treatment with several lines of endocrine therapy, including aromatase inhibitors and selective estrogen receptor modulators, the patient's disease has continued to progress. Imaging studies reveal extensive bone and liver metastasis. The patient expresses a desire to explore alternative treatment options for metastatic breast cancer. Which of the following targeted therapies is the most appropriate next step in the management of this patient's metastatic breast cancer? Trastuzumab, pertuzumab, everolimus, palbociclib, or bevacizumab? So the correct answer is palbociclib. So palbociclib is a cyclin-dependent kinase 4/6 inhibitor or CDK4/6 inhibitor that blocks the activity of CDK4 and CDK6, which are the key regulators of cell cycle progression. Palbociclib inhibits the phosphorylation of retinoblastoma protein, leading to cell cycle arrest and inhibition of cell proliferation in estrogen receptor positive, ER positive breast cancer cell. Palbociclib is indicated for use in combination with endocrine therapy such as aromatase inhibitors or fulvestrant for the treatment of ER-positive, HER2-negative metastatic breast cancer in postmenopausal women as initial therapy or following disease progression on endocrine therapy. It has demonstrated efficacy in improving progression-free survival and delaying the disease progression in patients with ER-positive, HER2-negative metastatic breast cancer. Here are the other wrong answers. Thank you for watching. Keep studying.